Let's move into floss. You've mentioned the slate flosser, and before you also mentioned silk. And I think when you mentioned that one, you said it's a little bit tricky to use. Talk about how you incorporate both of those into your routine.
So before the slate came out, again, from day one, I've been very concerned about floss and nylon particles breaking off. This goes back 25 years ago. And I'm not sure, I mean, as a dentist, you're always wearing loupes. We floss patients' teeth. I floss my own teeth. I would see little fragments break off. In the old days, we used to see little micro beads in patients' gums. Again, I'm wearing a 4.6x magnification surgical telescope on all my patients. And it's amazing what you can see. And again, you can't treat what you can't see, but we would literally, my hygienist would see it as well. We would see these little red microbeads. They're tiny, almost invisible to the naked eye. They were putting that into toothpaste to make it sparkle. It's not quite a microplastic, but it's between a microplastic and a chunk of plastic. And this has now been outlawed in California, thank goodness. But just for looks. So there are a lot of things that show up that we can see if we have magnification. Strands of floss, chunks of floss would break off. Where does that go? The body has to wall it off. Sometimes you can have a foreign body reaction. I've seen that where someone comes in. I typically can recognize it just by talking to a patient on the phone. It's usually a piece of popcorn, the hull of a popcorn, just based on the questions I ask. How quickly did it come up, the pain? Was it throbbing? Does it get worse when you lie down? Does it feel better when you floss it just for a few minutes? That is a foreign body reaction due to a foreign particle that is not dissolving, and the body overreacts and sends all the blood to that area. And if it's a popcorn kernel, you tie a double knot into floss and you drag it through there a few times, the hull comes out, and the pain is gone almost immediately. If it's a piece of plastic from a toothbrush or floss, that's more difficult. The body freaks out when it sees that, and that has to be fished out. I have fished out small pieces of plastic, and they're more difficult to see. The Teflon floss, which I liked in the beginning 30 years ago. When it came out, I thought, oh, this is brilliant. It was Gore-Tex. Gore-Tex came out with the product. They used the PFTE. It's a Teflon-based product. They sold it to Oral-B, I think, Procter & Gamble. And you don't want to be using Teflon. Small pieces do break off, and you're ingesting that beyond microplastics and microbeads. And then just pure nylon floss is a problem. The slate flosser uses a PFAS-free floss. Those are good. I've looked into it. Very inert and durable. So you can use it many, many times. If you really are paranoid and you want to, paranoid in the good sense, I'm not saying in a bad way, and you really are working on being clean and trying to avoid every single contamination, use the Radius floss. Again, I mentioned the Radius toothbrush. This is a natural product. It is made by silkworms, and it's biodegradable. The case, unfortunately, isn't. I wish it didn't come in a plastic case. It should come in like a paper, waxy paper case that will break down in landfills. But if something breaks off, it's a protein. It's silk. There's no foreign body reaction. So is it more difficult to use than a Teflon floss? Yes. Flossing is a very difficult thing to do for patients. It takes a lot of dexterity and coordination, and it can be painful and uncomfortable. And a lot of people have floss phobias. That's why the Teflon floss is good. I mean, it works for people. So Radius floss is more difficult to use. I would argue that the slate flosser is the best thing out there right now, even though it's not silk, because it's easy to use. It's really a game changer. It's more than floss. It has these patented little hairy silicone gum sweeps. It really cleans well, and it vibrates at 12,000 cycles per minute. It was invented by a dentist up in Washington, Dr. Snyder. I just have to hand it to him. I wish I had thought of it. It is really an amazing device. It is one of the great big leaps in oral hygiene care for home care. Again, it's plastic. It has batteries in it. I understand that, but if you have oral disease, this is something you need to get on. And theoretically, it could last a long time. The batteries come out, and you can recycle your batteries. So it doesn't have a rechargeable battery, which I like. And the batteries last for months. But the design of it is amazing. And again, I'm not associated with him. I don't own any portion of his company, but I just like it so much that and we use it at home. Everyone in the family uses it and we love it. My go-to was a floss stick, unfortunately made by Listerine company, but it helped a lot of people because people can't wrap floss around or they're not willing to put their fingers in their mouth. They find it difficult. A floss stick is a great way to go, and there's nothing wrong with using a floss stick. This takes it one step further. The Slate Flosser. It's a rigid, bigger circumference handle. The head doesn't flex, and those gum sweeps it's more than just flossing. So use the Slate first, then use an electric toothbrush, use nanohydroxyapatite toothpaste. You're really gaming the system that way in a great, healthy way.
You've got me convinced. How long have you been using the Slate instrument?
It's been about 4 months, and I really stay excited about things. And I've got 2 of them, and my wife has one. She is just bonkers about it. She is the oral hygiene queen, always has been, and she can't even look at floss. It's like if she's got to have this nearby. And when we get low on the little replacement head, she gets very nervous. She needs to have like 100 in the cupboard behind us. Anything below 100 is too low.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Most acidic drinks like kombucha and a lot of mineral waters, Perrier, for example, they're pretty low. Coffee, wine, iced tea, my favorite, those start off at a low pH. And if you're drinking a lot of that,